I'm Jimmy Holmes, Market President and Publisher of the San Antonio Business Journal. Welcome back to Executive Insights. Today, I'm joined by Ed Banos, President and CEO of University Health, to discuss University Health and its economic impact in San Antonio. Welcome, Ed.
Welcome.
All right, well, let's get started. To start off, could you give us a brief overview of University Health and who you are and what's your role in the community?
Well, University Health is the public hospital system for Bexar County.
Okay.
So we are a hospital district by title, by state, and we are an academic medical center here in Bexar County, right in the medical center. Mm-hmm. We have about 12,000 employees. We're about a little over $4 billion. We do about 40,000 patients discharges a year. Pretty big hospital, employed physician practice, and as I said, a very active academic medical center.
So when people hear public health system, they might assume it's mostly tax funded. Can you explain where most of your operating dollars actually come from?
Well, as a hospital district, we are a taxing district in Bexar County, but only about 15% of our revenues come from taxing. We are a hospital, we are a healthcare system, so we bill insurance. We do take care of the uninsured, the people that need the care the most in Bexar County, and that is our mission and what we're committed to. But we've committed years ago to taking care of everybody who needs our services, and those revenues help offset our commitment to taking care and keep the tax dollar at a minimum.
Okay. You've been expanding rapidly across the region. What kind of ripple effect does that have on the local economy?
Well, it's incredible when you look at how much an impact of building two community hospitals are. When you look at the cost of these two community hospitals, they're running about $1.5 billion for the Retama Hospital and the Palo Alto Hospital. But the economic impact that we have from those jobs, from the future growth in those areas because of healthcare, we've had a study by Perryman for what's the economic impact, and some of the dollars are incredible. About a $5 billion impact those can have for those communities in that part of Bexar County and all of Bexar County, just alone by just building these hospitals, hiring these employees, and then generating all the ancillary business.
Wow. And speaking of that growth, when you look at construction projects and new facilities, how much of that work ends up supporting local businesses?
Well, we are very committed to using local and using the best people we can to build the hospitals. And in all our projects, everything done at university is how can we use local labor first? The two hospitals right now run about 70% of all of it is local laborers, tradesmen, construction companies, architects, and we're very, very excited about that. Now, the other 30% are things that you can't necessarily buy in Bexar County, like large medical equipment, other things that are bought across the country or around the world. But we're committed to making sure that we can use local when we can.
So beyond the construction side, how does University Health's overall growth translate into new jobs or opportunities across the community?
Well, we think, first of all, the Palo Alto Hospital, where there's such a health desert in the south side.
Right.
This will not only start the jobs that are being created now, along with the development of the south side. And I would say that our partners like Toyota, JCB, and the others that we've talked to are very excited about having healthcare down there for the employees that live down there. So for us, this is taking a healthcare desert and an economic desert and working with these other large employers down there and making this a vibrant employment zone. So we see a lot of opportunities for the ancillary businesses of not only supporting the healthcare, but getting your local HEBs to grow, your other developments, the housing down there, which is incredible with the Vita development, which we partnered with when we bought the land, the housing that's going on down there, just the ripple effect of both Retama and Palo Alto with the growth and then the ancillary growth with all the employees and the revenues.
So San Antonio is unique in having a locally owned and operated public health system. What does that mean for the community, and how does University Health reinvest in local priorities?
Well, I think that's the thing that's the most important thing when you hear about locally owned and locally controlled. One thing is when you look at University Health, we have our own health plan, which is Community First Health Plan. It takes care of about over 160,000 Bexar County and the surrounding county people. But those dollars and how they treat healthcare and managed care, they live here. Those are their neighbors. So they understand the needs and the healthcare in Bexar County and the surrounding counties. And the same thing with University Health and our University Medicine Associates practice, as well as the hospital. Any dollar made, first of all, we want to be good stewards of the taxpayer dollar, because we're going to take care of the uninsured. And those dollars are hundreds of millions of dollars of care of people that don't have resources or don't have funds to pay for. We're going to take care of them. Anything else that we can do, we reinvest that money back into the community. We're building clinics, we're hiring employees, we're investing in these 2 new hospitals. That money stays in Bexar County. It helps with signature programs like our transplant program, our level 1 pediatric and adult trauma. It's all that investment that keeps coming back, making local choices by local leadership to make sure that it's reinvested.
Fantastic. So you also partner closely with UT Health San Antonio. How does that collaboration strengthen both your workforce and the broader local economy?
Well, UT's been a great partner. We wouldn't be an academic medical center without UT. We have over 850 residents that we are on the paymaster that we pay. 600 of those are dedicated to University Health. That commitment to medical education is about a $75 million commitment that university makes every year in the paying of the residents and their faculty or their salaries. Then we have a financial agreement with UT to make sure that they're covering our hospital and teaching those residents. And the combination of those two together, of the UT teaching, us supporting the residency and the growth of future physicians, has a huge impact on the community to make sure that Bexar County has some of the best trained and then future doctors that are going to be able to come back and treat. And it's all because of our great relations with UT. And I will add, though, that we also have been supporting the other medical school in town, UIW, and their internal medicine residency program. They have residents that come and train through us. So UT is our primary teaching facility partner, and we certainly are all in with UT because of what the great work they do. But we also know that the more residents and the more faculty that we can get in this community are going to grow all parts of Bexar County and the community.
Right. Absolutely. In recent years, you've opened up new centers in historically underserved neighborhoods, which you talked about earlier. What difference will that make on families that have not had access to that kind of care?
Well, I think the best thing we ever do at University Health is that we listen. And when we hear from our county commissioners, Commissioner Tommy Calvert or Commissioner Clay Flores, they talk about we need healthcare in our communities. And just a few weeks ago, we opened up our Wheatley Clinic, which is over on the east side. And with Commissioner Calvert and the community leaders, they said they didn't have access to convenient health care. They didn't have access to Express Med, which is after hours urgent care. And again, University Health is listening to the community needs, and we're building those clinics. Same thing on the south side. We want to make sure that no one has to travel all the way to the medical center just to get health care.
That's fantastic. Finally, as you look ahead, how do you see University Health continuing to balance the growth with its role as a community anchor?
University Health wants to always be at the table and be able to make sure that that everyone in Bexar County can be taken care of, including the underserved and the uninsured. That's a voice that we always were going to be making sure that their voice is heard when it comes to healthcare. It doesn't need to be, it could be preventative health care. It could be just access to health care. But University Health wants to listen and know how we can make health care available for everybody, but not just a select few.
Last question I always like to leave with is, what's something that our readers and viewers should know that they may not know about, the expertise you have at University Health or some of the specialties that you have? What
I always have been trying to say now is that, University Health for many years was seen as that's the public hospital system. And we're always going to take care, as I mentioned earlier, about the underinsured.
Sure.
But what I would say to a lot of people in the community that don't know us well is We're an academic medical center, which means we've got the best and brightest doctors, nurses, and others taking care of it. And if you need a liver transplant, if you need a specialty service, 99% of that services can be done at San Antonio and at University Health. And people don't have to go to Houston or Dallas for that high-end healthcare, because it's right here with fantastic doctors and nurses who are training the next generation.
And you've mentioned sometimes another hospital system in the area might have a doctor or specialty that they currently short-term don't have. And you feel the need because there's a need for that care. Y'all have stepped in from time to time to help support that.
Yeah, absolutely. Yeah, absolutely. We're here to make sure that everyone can get taken care of. And unfortunately, and sometimes in the other systems, we're getting called because they know their patients are so sick that they need the higher level care of at University Health.
Sure.
And we're just, we're here to take care of everyone in our community.
Yeah, the patients first, and we're glad to have you in the community. So Ed, I want to thank you so much for taking your time today. Your insights are valuable resource for our viewers and subscribers, and thanks again.
Thank you so much. It's my pleasure.
All right. Look for a next edition of our Executive Insights coming up shortly. Thank you.